topics. A simple in-office medical procedure is literally helping patients breathe easier. Dr. Nadim Bikhazi from Ogden Clinic is here with his patient, Leesa Brinkerhoff, to explain how this works. Thank you both for being here.
Thank you.
I'm really anxious to hear your experience, but first, break down this procedure for us, Dr. Bikhazi.
Let's talk about the patients who would benefit from it, those that suffer with chronic sinusitis, which is a constellation of symptoms of facial pain, congestion, and nasal drainage, very common in the winter coming into the spring seasons.
I think the congestion obviously is something people can relate to, but actual pain they're experiencing because of all of the blockage?
Yeah, the best way for our viewers to think about it is a sinus infection that just never ends, continues on and on and on. And they often will reach out for medical treatment, decongestants, and antibiotics. But once you've reached the end of that, where you're not getting benefit, that's really the role for surgery, and in this case, a minimally invasive procedure in the office.
Well, that's where you piqued my interest, because I've gone down this path a little bit myself, and I think that what comes to mind is that painful surgery that we've all heard about, the shaving, the packing, all of it. You have a different option that is a little bit easier.
Yes, it's not a new technique. It's been around for 10 years, but really it's gained popularity in the office setting in the last 5 years. And essentially what happens is a catheter is placed in an obstructed sinus and a balloon is used to dilate it.
Okay.
And it's done under local anesthesia, very similar to what a balloon angioplasty does for people with heart disease. This does for the sinus sufferer. It opens up the passage.
Oh, wow.
So therefore now you have permanent opening and ventilation.
We are seeing it happen. And you say permanent. That will last for how long?
It's permanent. We participated in a national study where we looked at the long-term effects of balloon procedure versus regular surgery, equivalent efficacy over up to a 2-year period.
Leesa, what was your experience with this procedure?
It was a very positive one. I actually had sinus surgery about 15 years ago, the traditional type, and so I was off work and I had packing and the recovery period, etc. This, it was comfortable. He actually, told me what to expect, went into his office, and it was done within about 45 minutes. I was comfortable, walked out and was back to work not that day, but the following day.
This isn't a question I ask everybody, but how are you breathing now?
I could breathe instantaneously.
Really?
I even mentioned it as soon as that balloon went. I said, oh my gosh, I can finally breathe.
You felt it in the moment?
In the moment, wow. Absolutely. And it's been wonderful since.
And I imagine you were someone who's experimented with all of the sprays and the decongestants.
For years and years and years, yes.
Yeah.
Yeah, there just didn't seem like there was any hope in sight. But
are those medications still part of your routine?
No.
You've eliminated the medications. That's awesome. That's awesome.
Yes.
Is this procedure covered by insurance?
About 50% of insurance is covered, but gaining in the state. And as we get the data out that the long-term results look as good as sinus surgery, we're getting more insurance coverage.
And emphasizing 45 minutes.
Oh, it's like a dental procedure, but I think even easier. It's really convenient. And here's the main thing, Brooke, is the co-pays tend to be less because you don't have to have expensive hospital care, general anesthesia, and much quicker return to work. I mean, the study looked at that. Patients did so well. They were back to work and doing what they do within a couple of days.
Where can people go, or who should they call to see if they're a good candidate like Leesa was?
Call us at the Ogden Clinic. Our phone number is 801-475-3075, or they can go to the ogdenclinic.com website and look up my name, Dr. Bikhazi.
Well, thank you for telling us about it, and I'm so glad you're feeling better.
Thank you.
That's great news. We'll post all of the information on our website, too, to make it easy for you to access if you fit into that category of a patient needing help with that nasal decongestion. We'll be right back.